Welcome to the James Cooley Show. It's your life, and tell you, I got this great guest co-host with me today, and you all already know him. He's almost a permanent fixture of the JC Cooley Foundation, JC Cooley Show, and so we have this absolutely wonderful show set up for you today. This is the first part of our 4-part series called 360 Degrees of Health. And Dr. Michael Mantell, wow, what a great plan and what a great show that we're going to have today.
That's so true, Dr. Cooley. And I want to thank you for the idea, because you were the brains behind this, not just in Brains Magazine, but you're the brains behind this whole series. And we have put together quite an array to look at health over the 360-degree lifespan to increase it to a health span. So let's move on with our first guest today.
Wow, we're going to move on, but wherever you're watching this at or listening to it on the radio or watching it on over 45 different live platforms, including E360 television, Transverse television, LinkedIn, YouTube, Facebook, et cetera. Welcome to the show. And if you want to be part of the show, all you have to do is just go to the platform that you're watching us on and just put in and ask any question that you might have, and I promise you we'll get you an answer. Doc, I'm excited about this guest. Dr.
Jessica Matthews. She is number one.
Man, her curriculum vitae, man, I know I ain't gonna do that much greatness because she got so many things on there. She's doing so many wonderful things. But I want the audience to know a few things about this great doctor. Dr. Jessica Matthews is an award-winning educator, associate professor, director in the College of Medicine Science at Point Loma Nazarene University, where she created the Master of Science Integrated Wellness Program. Boom. She also served as the Director of Health and Wellness and coaching at San Diego, UC San Diego Health and the Centers for Integrated Health, where she has spearheaded that includes cultivating a team of national boards, certified health and wellness coaches. And she has done so many other things that we're going to talk about. But extraordinary young lady. I can't say young. That's doing so many big things. So, Doc, I tell you what, let's just bring her on and let her tell us about some of the things she's doing. So welcome to the show, Dr. Jessica Matthews.
Oh my goodness. Thank you so much, Dr. Cooley, Dr. Mantell. What a privilege to be guest number one. I feel especially esteemed to be like, wow, I've got big shoes I need to be filling right now to be like setting the tone for a great series that you have planned. So what a special invitation to be here.
Wow, we're so happy to have you here. I always use the first segment to for our audience to get a chance to know our fantastic guest. So, Dr. Jessica, can you tell our viewers and our listeners a little bit about you, where you grew up, what triggers you, and what prompted you to become a doctor?
Wow, there's a big story behind this, as I feel like many great things in life, but I will try to give the paraphrased version. Well, first, Dr. Jessica Matthews, I go by Jessica and Jess. I am a wonderful, complex human being like all of us are. But what started me on my journey and what led to many of the things you so excitingly shared about some of the work that I do, what led me on this journey actually was quite challenging circumstances. So born and raised in New York, even though I now call sunny San Diego, California, my home. As part of my upbringing in New York, the thing I witnessed firsthand was the devastating effects of chronic lifestyle diseases in my own family. Now, at the time, I have to share, I didn't know they were lifestyle-related diseases. I just knew them as things like type 2 diabetes, obesity, heart disease, and they were things I saw with my grandmother, my Nana, with my own mother, with my aunts and my uncles. And at that time, as a small child, first I thought that was just, our genetic destiny, right? Just runs in our family. And I also saw what was the real devastating complications of those diseases. Things like renal failure, blindness, amputation, not living past the age of 50, 60 if you're lucky, but your quality of life, those latter 10, 15 years was almost completely diminished. And it set me on this trajectory to say, how could I do something different, starting for myself and then for the other people I cared so deeply about, my friends, my family, other members of the communities I lived in, the world. Like, I started on this journey, and I started with the path of exercise. So my original start in this whole space was as a fitness professional, and I really saw the power in group dynamics. So I know we're going to talk more about that, but I started as a group fitness instructor teaching step aerobics and high low. So tells you I may not be as, I'm young, but maybe not as young as you think. But that was my start, and I saw the dynamic power of being in a group, moving together, and I just wondered what could become of all of this. Could exercise not only prevent those chronic diseases, but what about like my mom and my grandmother who already had those diseases? Could exercise be medicine for them? So flash forward just real quick. That led me to become first generation college student, pursued my undergraduate, graduate degrees in exercise science and teacher education. I wanted to teach others. And then doctoral training in behavioral health, which seems like a kind of out of left field, but I wanted to understand whole person health. So that's a summary view of how I've got to where I am today.
Well, you mentioned a couple of things because of similar parallel. I got started in fitness. I teach aerobics, especially. I consider myself an expert in step aerobics. So one of these days when we're in San Diego, we certainly got to get together for one of those little classes.
Great, move to the beat of the music and everything. Now I know this about you. So I already know we've got a lot of things in common, and we'll move in rhythm together. I love it.
Oh, absolutely, absolutely. So what are your thoughts, Dr. Mantell?
Well, I'll tell you, this just couple of minutes of that vibrant energy and that passion for helping other people and giving yourself, Jessica, to the world. This is why you were the first guest, and there could not be any other first guest. We share so much, the East Coast, and the same sort of thing with longevity or not longevity in life, our interest in coming at how we can help others expand their health span, live their best life. The fact is that you have so much to offer. I want to try and pick your brain and have our audience be able to ask you questions. And please, if you have questions, write them down, send them in, and Dr. Jessica Matthews, Jess, will be sure to answer them. I want to jump in, if I can, James, and start with this.
You got it, Doc. You got it.
We have in America the lowest life expectancy at birth, the highest death rates for avoidable and treatable conditions, the highest maternal infant mortality. We tend to think that health is the absence of illness, but that's not quite the way contemporary professionals are thinking about it. Tell us about what is health?
Well, it's such a great, it's sad that you have to bring up the circumstances of where we are, but it gives context to this need for this conversation. The interesting part is I do a little bit of history, and then I center into where we are and where excitingly we can go. The interesting thing is if we go back to 1948, the World Health Organization, the WHO, actually defined health as not merely the absence of disease and infirmity, but in fact, complete physical, mental, and social well-being. And I'm emphasizing those words because 1948, we were talking about the fact that, from a whole person perspective. Now, there's additional dimensions we can talk more about. Some argue that's not fully complete, but it invites us, as you were just sharing, Dr. Mantell, it invites us to actually take a step back to say, wait a minute, it's not just the absence of disease. There's more to living healthy and then living well. We talk about that word, well-being, wellness, and what that really means. So I just start by giving us history to say, we already knew back then this expanded view, and now where it's taking us is to recognize we must not only look at the whole person, body, mind, spirit, we must also look at the totality of the human experience, all that kind of social, ecological perspective, if you will, all the layers that impact health, longevity, all these things we know are so vital and that we can make a positive impact around.
Jessica, we can go back to 1948, but as you know, I love to go back to the beginning of time. Let's go back to the Bible, because the Bible says the same thing. It talks about what we need to do to live in a healthy way. It doesn't talk about just eradicating illness. It talks about the presence of realizing our potential, of looking at ourselves spiritually, psychologically. And so much of the work you do at Point Loma Nazarene University, at UCSD, with the American College of Lifestyle Medicine, talks about how we can promote ourselves socially, psychologically, spiritually. Can you talk a little bit about how that is brought into healthcare today?
Absolutely. And like you said, I mean, to go back to the beginning and to look at scripture, I mean, it really invites us to recognize this separation that has become commonplace in medical practice. And I do lecture a bit about this in one of the courses I teach at Point Loma Nazarene University. It's our first course on lifestyle medicine and integrative health. We can, again, as you noted, go back to scripture and actually even early days of medicine. That's what's interesting. Even as we started to say, yes, medicine must be practiced evidence-based, understand the scientific method, so important, right? I mean, we want to ensure all of those practicing in healthcare understand those things, and it should not come at the expense of addressing the whole person. And so where we arrived at this kind of reductionistic, dualistic, separate kind of approach, like the body is just a separate thing from the mind, and then the spirit is like, we don't know what to do with that. Like, that is actually not how medicine was truly founded. In medical education, the precedents were set, but yet that's the reality we have been in particularly in the United States. I'll center us. But to say that the movement forward, to your point, so the exciting path forward is this movement back. It's almost a coming back, a return to whole person healthcare, and getting to those roots of chronic lifestyle diseases, the things that actually will effectively not only treat, prevent them, but treat them and even put them into remission or reverse them. This is language we haven't heard. I mean, I didn't when I was growing up. I thought, this is my genetics, my destiny. There's nothing I can do about it. And we know that's not true. So it is inviting this whole person approach to come back to the center point, and to look at all evidence-based therapeutic approaches that do promote health and well-being and longevity, because we all deserve that. We have a right to that.
Wow, this is such a great topic already. But you know what? We got to take a station break. We're going to take a station break, and we're going to come back. As you see, this young lady right here, Dr. Jessica, is a genius. I can already tell. So we're gonna take a station break, and we're gonna come back and we're gonna pick it back up. So it's your life. If you want to be part of the conversation, whichever platform that you are watching us on, all you have to do is just go to the comments, ask any questions that you might have. I promise you we'll get you an answer. See you shortly after the break.
I never wanna leave. Yeah, I'm right where I wanna be. We got something you and me. And I can't get rid of this feeling. Just like a magnet, we're just like a magnet. The things we have can't be taken for granted. Now I know that it has always been you. I can't help it, I'm so drawn to you. Just like a magnet, we're just like a magnet. The things we have can't be taken for granted. Now I know that it has always been you. I can't help it, I'm so drawn to you. Hey, I'm so drawn to you. I'm so drawn to you. Yeah.
Really get a chance to know who you are. And once you know who you are, you truly know who you are, love who you are. Love who you are. You're a masterpiece. Love who you are. Love who you were born to be. Love me some me. That's what I'm talking about. When you leave high school, you gotta know today or tomorrow, or hopefully today, what your plans are. Hopefully, there is no bad decision unless there is no plan. Create collaborate, commit with confidence. Commit with what? Commit with what? In everything that you do.
Welcome back to It's Your Life. I tell you, I'm just so excited to be having these discussions, especially with these two absolutely magnificent doctors, because it's so important to all of us to have an understanding and know how to go about obtaining your ultimate health and fitness level. Not just one day a year, but 365 days a year. So that means that we have to be around with 360 degrees of health and fitness. And we got two other world-renowned experts here with us today. Dr. Michael Mantel, I want to pick it up and you lead the discussion where we're going to talk about social health and a lot of other things, functional integration. Can we get off into that?
Sure, absolutely. Jessica, you and I both grew up on the East Coast. You in New York, me in a suburb of New York called New Jersey. And here we are in sunny California. And we look outside and we see beautiful palm trees, and we look at the beautiful greenery and the weather and the climate. And we're very blessed, and we know it. And we're very grateful, and we understand what gratitude does for our well-being. One of the things that many people don't understand are how the social determinants of health, our environment, where we're born, where we live, where we work, where we worship, where we age, how that impacts the range of health or functioning or quality of life. And I wonder if you can talk a bit about the social determinants of health, because we're recognizing more and more what role that plays in our well-being and overall healthy health span.
This is such an important topic, and I know many that we've had great discussions about, that we share passion around. Again, not only we've talked a little bit about whole person health, right, and the various dimensions of wellness, but kind of centered on the individual, but this opportunity to look at, as you mentioned, the social determinants of health. And often I share with my students, one model we can look to is kind of that social ecological perspective I was mentioning before, to say, yes, of course, the things, that we do individually, health behaviors, lifestyle, practices we put into play, those play a role. We know they're very powerful, but we can't only look at those in isolation, because we have to look, as you were just articulating, at things like those other variables that do in fact impact our health. So we would not be doing people a service if we said it's only this one aspect. Yes, that's important. And you mentioned the zip codes in which we live. We see that has an impact on our health and well-being. The access that we have to, healthful foods, for example, access to, as you were alluding to, I know we live in the same geographical area, but neighborhoods, again, that zip code people live, is it safe to be able to open my door and go outside for a walk? These are the things we have to think about. Our family upbringing, cultural influences, systemic societal impacts. So things like government policies. And we can just keep going through all of those kind of concentric circles, so to speak, to say we must look at all of this in totality. And that's an area that we have had a bit of disservice. And we can't achieve health equity, meaning health and well-being for all, if we don't take into account all of those various variables. There's so many more: personal demographic variables, race, ethnicity, gender, age, other things that, again, are part of this discussion. So I appreciate you bringing that up, because it's so vital.
And I think that more and more physicians and other health-related professionals are beginning to become aware of this and talk about this. I know in your teaching at Point Loma Nazarene, this is an integral part of the curriculum. I know you talk about it at UCSD, and certainly in your role with the American College of Lifestyle Medicine. One of the things that we need to be able to do, though, is to help physicians ask more about these kinds of things. What are you doing to begin teaching health professionals about this?
It's amazing questions, as you always ask, because yes, it's great to, we can talk about it, learn about it, be informed, and then we have to change the system. So we start by changing, as you were asking, what can we do from an education perspective? And that is what is unique about our program at Point Loma Nazarene University, is just the compilation of students who come into our graduate program, because they are reflective of the true interdisciplinary care team, meaning they are aspiring physicians, they're practicing nurses, practicing registered dietitians, health and wellness coaches, exercise physiologists, and many more professions I'm not stating now. But to share that kind of showcase, we first have to get all of the health professionals that are on the care team, the patient-centered care team, which is key, to actually be on the same page. So we have to change the education that professionals receive, and that is happening across not only our program at Point Loma, but excitingly other colleges and universities, medical schools. So that movement is happening. And then also what's happening right now in clinical practice too. And I can share from, perspective of UC San Diego Health. One of the things, we're doing as clinicians, again, various members of the care team, but primarily led by our physicians, is they are gathering information around social determinants of health as part of the complete picture of someone's health, not just solely, diagnostics and other, but again, looking more at the whole person and their whole landscape in which, they have been brought up and in which they currently exist.
And this brings up a very important understanding for the public who's watching, as well as all the healthcare followers that you have. Medicine is no longer simply, where's the pain, here's the pill, come back in 3 weeks. That's history. Today we have functional medicine, we have integrative medicine, and we have holistic medicine. Can we talk a bit about these three branches of how physicians and healthcare professionals are beginning to understand and look at people?
Absolutely. And this is so exciting, as you said. We're moving forward. And so it's exciting to see, the enthusiasm of individuals entering the healthcare profession, but also those who have been longstanding, in various roles, physicians, nurses, etc., really embracing this new perspective because it best serves the individuals, the patients they serve, or the individuals listening to this show right now. So it is exciting to look at all of these different areas. What I like to do, you may know this about me, I like to look at what's in common, because there's so many different terms. You hear integrative and functional and lifestyle and holistic, but let's get to the heart of what they're all actually saying, which is this. They're all focused on that whole person health we talked about. So addressing body, mind, and spirit. They all are focused on that. They also are all focused on the use of evidence-based therapeutic approaches that really center on lifestyle. So again, that's the common ground. It's to say, because that's where we have so much scientific evidence to say things like what we eat, the ways we move, the ways we connect and love others. And, those things they don't just feel good and sound good. They are good for you. So these are the common grounds across these different areas. And then the other piece that comes back to, as I said, that patient center, the recognition everyone is unique. Everyone has different dynamics in their life. And we have to take all of that into account. So that's the part, sometimes terms, and I'll be honest, even my students, graduate students, they get so confused. They say there's so many different terms, but if we start saying what's the shared language and foundation, we can recognize we all are actually moving in harmony in a direction that best serves patients, the public, and that really will transform health and health care. And that feels very exciting to me.
I'm very excited when I talk to physicians who no longer apologize for combining conventional Western teachings with complementary or alternative therapies to treat the whole person, mind, body, and spirit. Cardiologists that I talk to are talking about the heart beyond the actual heart. And it's just very exciting to see that physicians and related healthcare professionals are going beyond talking about the environment, talking about nutrition, and all sorts of other approaches that people can begin using. I know that this is such an important part of the education you bring. And I want to talk a little bit about the 6 pillars of health, because it does encompass the whole person, and it brings in functional and integrative and holistic approaches. And let me ask you this, Dr. Cooley, where are we with our break? I don't want to.
No. We good. We got about
Good?
6
Okay.
pillars. I want to hear about these 6 pillars.
6
Well,
pillars.
at least we get through half of them.
Okay.
And then we'll take a break.
Okay, I want to be respectful of our time. So, Jessica, talk a little bit about the American College of Lifestyle Medicine's coming upon these 6 pillars of health.
Can you tell there's the East Coast connection? We're talking a lot, so I'm glad we have a time check, but I will give the high-level overview. This is what's so exciting to me, because I gave my family background, what lifestyle medicine uniquely is. Because lifestyle medicine, it's a medical specialty, a rapidly growing one that really focuses on the use of therapeutic lifestyle interventions as a primary modality to treat chronic lifestyle diseases like the ones I shared in my own family. How that's done is the part you were just alluding to, Dr. Mantell, about the 6 pillars. So, professionals on that interdisciplinary healthcare team, we practice, because I'm board certified in this area. How we practice this form of medicine is to apply these evidence-based whole person prescriptive lifestyle interventions around the 6 pillars. So I'll just name them right now, because these can treat, by also they prevent, and they can even reverse or put into remission these chronic diseases. I can attest to that with my own mother, whose type 2 diabetes is in remission based on lifestyle changes. But again, very intentionally dosed, therapeutically dosed. The 6 pillars, though, just to outline them, at least before we might take a pause, is these areas: regular physical activity, restorative sleep, stress management, avoidance of risky substances like alcohol and tobacco, positive social connection. So see this theme emerging. And then, of course, importantly as well, an eating pattern that is primarily focused on whole foods and plant predominant foods. So that's the 6 pillars. And that really sets the groundwork. And it's all centered on a foundation of behavior change, which I know Dr. Mantell and I share so much around, but at least to just give us that context or lay of the land of what lifestyle medicine is, what are those pillars. And we have so much depth of evidence, and then practices people can put right into practice today to start improving their health well-being.
Wow. I want to go ahead.
I tell you, let's hold that thought right there. Putting it in perspective for today, because we got to take a station break. But I am so excited to hear a little bit more about the 6 pillars. You can break them down so people can understand exactly how they work. But we're going to do that shortly after the break. So if you want to be part of the conversation, all you have to do is just go to the platform that you're on and just ask any question that you might have. I promise you, we'll get you an answer. It's your life, and we'll see you shortly after the break. How you doing out there? Hey, I'm Dr. James J.C. Cooley, and I will be teaming up with Dr. Michael Mantell, where we're going to do a new series beginning November the 1st. It's going to be a 4-part series where we are going to talk about health 360 degrees, where we teach people how to just think of themselves. You get your mindset right and just think fitness. And we want everybody to dream big, think big, and be big. And we want everybody to be in their ultimate fitness condition, mind, body, and soul. So this show starts November the 1st, 12 p.m. Pacific Standard Time with Dr. Michael Mantell, world-renowned doctor that's doing so many great things, and myself, Dr. James J.C. Cooley. So we want everybody to tune in to our show November the 1st, 8th, 15th, 22nd. Who knows? Might be a permanent series. Dream big, think big, and be big. James J.C. Cooley from the United States of America, and I am here to just say, first of all, I'm so happy and honored to be honored to be in the Coffee Book 2023, Unified Brain Z and other organizations. Thank you so much for giving me an opportunity to be a part of this collection. Hello, welcome back to It's Your Life. Just like I said, you got two absolutely wonderful doctors here that, I'm just sitting back, just get the education. It just come in. I said, let me grab a little of that. Let me get some of that one too. That's what it's all about, is being able to, listen and learn. Look, listen, and learn. And when you learn, you obtain those things and you put them to work. To help you reach your ultimately health and fitness level. So Dr. Jessica, we was talking about the 6 pillars when we went to the break. Did not want to take the break because it was sounding so wonderful. I would like, if possible, if you can break down those 6 pillars so our audience can dab off into this and get a better understanding, and so that they would know how to put them to work.
I would be delighted to share. And I think, really thinking practically is how I always think, because knowledge is power, but I always like to say it's knowledge translated into action. That's the real secret sauce, so to speak. So very fitting, I think, as we look at the pillars, things like, I'll use one because it's such a topic that honestly many people get very confused about, is something like nutrition, right? Something so vital. I mean, we need to sustain life, but it's very confusing to know, like, what should I be doing? Is there a certain diet I should follow? So when we look at this pillar around nutrition, what we really focus on in the practice of lifestyle medicine is really an eating pattern that is focused on whole foods and being plant predominant. So, wow, a lot of words, but what does that actually mean in practice? It means including more foods that come from the earth. So think fruits, vegetables, whole intact grains, beans, legumes. And what's exciting, talking from that level of looking at social determinants of health, kind of that ecological perspective, what many people don't realize is actually that's a very not only healthful way of eating, but it's very cost effective too. And so as we work to think, what are more ways we can integrate those plants into our diet, right? So add more, not take away, I'm saying add more, and also do things like eat the rainbow. That's a very common tip. And it sounds like, is there a lot of science to that? There is. Eating a variety of different color fruits and vegetables. So orange, red, purple, green, think the rainbow. Those are actually really practical and science-based tips to get different micronutrients, phytochemicals. Again, getting a little technical nutritional science, but it's to say, if we use our eyes and we have this wide variety of different plant-based foods that we're incorporating in our diet, wow, can that improve our health? So that's just, goodness, JC, that's one pillar. I could keep going on and on, but these are some of the practical ways we take the science and then we make it, again, individualized to the person who hopefully is listening to this and saying, wow, you know what, Jessica, I could do that, right? I could eat a couple different colors of fruits or vegetables. I could get them frozen because they have nutritional value. I can get them in a way accessible to me. That's actually something I could do. And that feels very empowering and very exciting.
I find that when we go through these pillars, many people say, yeah, that sounds great, until they're eating their chocolate bar and all the Halloween candy from last night and everything else.
I tell you, I stayed away, Doc. I did not eat any of it.
Well, we ran out of candy to give. Couldn't believe it. And I said to the kids that were coming to there, okay, we ran out of candy. So now I'm going to give you something healthier. Let's talk about, what does Halloween mean to you? They looked at me like I was crazy, which I may be, but guess what? We had some good conversations, and the parents were standing at the end of the walkway looking like, I said, you can do the same thing. I have a question, not for you, Jess, but for our grand host, Dr. James J.C. Cooley.
Okay.
James, you epitomize healthy lifestyle. I don't want to embarrass you, and if you can tell me stop right now, but you do your 6-mile hike every morning, at least most mornings.
Mhm.
And I know you and Michelle eat really well, and you get sleep, and you do what you manage stress. I know all the things you guys do very well. I have a question. What leads you to do this? I'm trying not to say why. There was an article that just published about how important it is to ask people why, but I don't like that question. So I'm going to ask you, what is it that leads you to go on that 6-mile walk every day?
Well, let me tell you, first of all, some days I don't want to do it. I mean, I just don't want to do it. But I have, how would you say, discipline myself that it is absolutely necessary that I keep my word to myself, even when I want to break my word. And so it's a self thing that I will start feeling bad if I don't do it. Sometimes, Doc, I'm gonna tell you, I lay in the bed, normally I do this about 7 o'clock. I lay in the bed at 8. I said, sooner or later, my mind gonna tell me not to do that. I don't have to do it. And next thing you know, I'm out there. I'm out there doing it because it's just integrated into my system, my mind, my body. And if I don't do it, my body parts will let me know. So I don't want my body parts talking to me like, hey, you didn't get out there and do it. So it's just a commitment, Doc. Commitment to doing these things. Just like Michelle have a commitment doing this F45 every morning. So it's just a commitment that we have.
So you see, Jess and I don't have that. We just do it because we know, no, that's not true at all. we do the same kinds of self-talk. And whether it's stress management or sleep or social connections, which is so important, that has become blown up in terms of the attention it's getting. Just talk a little bit about the concept of behavior change and how that's now infiltrating medical practice and how physicians and healthcare professionals are understanding how we talk to ourselves and how we create motivation. So tell us about this concept of behavior change to help people apply these 6 pillars.
Right. I love that you mentioned we are human, just like, I always say like, hi, I'm human too. So even though I do this for my work, and I'm very blessed to do that, I am also human, just like you, Michael, just like you, JC. So thank you for sharing also, a bit about your why. And I love that, Michael, you didn't ask a why question, but you got to the heart of his why. But behavior change, as I was alluding to before, it really is the foundation. I use my hands because I'm from New York. The foundation on which the pillars all sit, as you were mentioning. And this idea that really, I talk about it a little bit, in fact, in a TED Talk that I did in 2019 titled Reclaiming Wellness, very fitting for our conversation. But I talked about something I know is so near and dear to your heart and decades of work in this field, leading this, Michael, is this aspect of behavior change, really starting with how we think, because the way in which we think will really have a positive or could potentially have a negative sort of domino effect on our lifestyle. So I talk about this power of perspective, right? Really that being, when we talk about wellness, people are like, perspective, like what does that have to do with anything? A shift in our perspective, a shift in the way we talk to ourselves, as you were alluding to, the way in which we engage not only with ourselves, but others, the world around us, the bigger picture, the real life stuff. This is vital. And all of these pillars, they have to stand on this aspect of really understanding and getting to the heart of what you were getting to, the why, like our personal why, our values, and then in turn our priorities, because that will then help to drive our actions, not only in the short term, but where we see this greatest benefit for health and longevity is repeated action in the long term.
Yeah. And we know that so many physicians today are facing burnout and dealing with exhaustion and not having enough time from corporate headquarters giving them to talk with patients. What are you finding that physicians, particularly healthcare professionals, are saying about taking time to speak with patients about helping them find their why?
It's the challenge is what you mentioned, like many things in life, time. And it's a system-wide issue, right? You alluded to, it's the way that the practice of medicine in the predominantly fee-for-service model, which is common in the United States, it's just time limited, right? It's very, quick, minimal interaction with patients. And so, yes, and that's why we do have, broader focus on provider or health professional well-being, because the people caring for people have to be well to help the people they serve to be well. The challenge is time. And so the opportunity I have that I'm very fortunate, I know we share in this, is being able to equip physicians and other healthcare professionals with ways in which they can, in their limited, time they might have, make a big impact. It makes me think of Dr. Cooley, that, like, live big, the big impact you can make with sometimes one simple, powerful question, much like you were asking Michael of trick-or-treaters last night. But wow, we can do that in healthcare with one question. And then I will add, also working as part of a team, collaboration, because that's where the real magic happens.
There's a saying, it's not what's in the black bag that's healing. It's what's in the heart of the person carrying that black bag. And I think it's so important, especially in this area of lifestyle medicine, to allow the doctor and the healthcare professional's heart to be seen and felt and experienced. But not just the physician, the person who answers the phone, the person who says, how are you really feeling? That's what we want to see more and more of in health care. I remember saying this so many years ago, I don't remember when, that when physicians became providers, it all began to collapse. We don't want providers. We want, at Point Loma Nazarene, you were kind enough to ask me to teach a class for the physician assistants. And I think I told you, I started the class by saying, what's a PA? Physician assistant. No, what is it? What's a physician assistant? Well, who is this guy? He doesn't know what. No, it's a patient assistant. Dr. Cooley, as someone who sees doctors and talks to doctors about your own health, what's your experience with that?
You're talking about physician assistants, or my experience with seeing doctors is they have to be patient oriented first, and most doctors are. But you run across them that has no personality, and it's all about work, and make the patient. Sometimes it make the patient. Sometimes make me feel like I'm just a number. I'm just walking in. But I believe that in order to help a person, the doctor have to be down to earth as well. He have to, or she have to show that they care. They got a genuine care, or ensuring that not just getting paid, but making sure that the patient is going to be happy, and making sure that the patient is feel at ease when they get ready to leave that office.
I could say something, because Dr. Cooley, like, words of wisdom here, and you might have not even known you were articulating. There's a thing called the quintuple aim in healthcare, and this gets to that patient-centered piece you meant. Like, as you were just saying, Dr. Mantell, this is the heart of the patient is what matters most. Like, and as provider, that's transactional. We're not like selling a good. I mean, we're caring and helping heal people. This is a big responsibility that I know my physician colleagues do not take lightly. None of the members of the care team. But what you were just saying, Dr. Cooley, about the patient experience, like how you feel when you're I'm a patient too. When I go and I am focused on my health, right? And I'm with my members of my care. See, I'm using my care team. I want to feel like they know me. They're asking me about me. They're committed to my health in the same way I'm committed to my health. And so that's really vital to good medicine and good healthcare. So too is then having a good care plan that helps you to thrive in your life, right? To live healthy, to do the 6-mile hike in the morning. Like, you're helping to do that, and you're working hopefully with a great lifestyle medicine trained clinician or physician to say, wow, this should be a part of your prescription. This is medicine. This is how great medicine's practiced. So you were just highlighting some things. I had to jump in because, wow, that's, yes, the framework of where healthcare needs to be. And we are excitingly moving in that direction with great qualified professionals that can be providing that kind of care.
Wow.
I want to get into that. We're going to take a break.
We got to take a station break. But when we come back, we're gonna cover it. Hey, thank you so much, Jessica. Thank you. We're gonna take a station break, but we're gonna come back. It's gonna be a short break this time. We're gonna come back up and we're gonna pick it up. Dr. Mike got a question and probably got a million answers as well. So you want to be part of the conversation, not too late. Let's go to the platform that you're on. Ask any question that you might have. I promise you we'll get you an answer. Yes, your life. We'll see you shortly after the break.
Noah Dingley here, producer of The James Cooley Show, It's Your Life. And the new audio version of James' book, Country Boy, City Boy, A Journey That Ain't Over Yet, is a must-have. James shares his true life story of struggle and success in America. It's both a cautionary tale and a roadmap to achieving the American dream. Get the new audio version of Country Boy, City Boy, A Journey That Ain't Over Yet by James Cooley on Amazon.com or wherever audiobooks are sold.
Welcome back to It's Your Life. I tell you, this conversation that we're having, I don't want it to end. But we got four parts of the series. This is the first one, and I promise you, we're gonna come back to Dr. Jessica on another series later on down the line. I hope she have time because she is so wonderful and so, how would you put it? She's able to put it in layman's term where you understand what's needed, and that health and fitness is a lifestyle. It's not just for one day or 2 days. It's a lifestyle. So I am loving this conversation, and I hope you all are as well. So I'm going to turn it back over to you, Doc. I know you had a question.
Yeah. And I couldn't agree with you more that this is why Dr. Matthews is our first guest on the first of this series of 360 Degree Health. And for sure, you're going to be back again, I'm sure. But yes, we have nutrition, we have physical activity, stress management, restorative sleep, reducing risk or eliminating risky substances. And one of the pillars that I think has become more and more important are social connections, even talking to a stranger. Some new research came out recently. Dr. Waldinger just reported on very recently, even talking to strangers can be valuable. Let's talk a little bit about some science-based practical strategies to support health and healing and well-being. Let's dig into some specifics. What tips do you have based on science that have research behind it to begin to support our health and healing?
My goodness. Well, I'm taking you up now with that question on the invitation to come back because there's so many things I want to say. The beauty is there's so many things we can do. So not to overwhelm anyone, but hopefully to excite and empower individuals to say, we can do this and we can start doing things today that we continue tomorrow and the next day. And as Dr. Cooley was saying, for our life, for our exciting, joyous, beautiful life. but some of those practical things, because I am and I appreciate those kind words of translating the science into things we can actually do. So some of those practices, because you did mention, Dr. Mantell, this important pillar of social connection, and sadly the announcement, we have a loneliness epidemic that was recently announced by the U.S. Surgeon General. It's an issue that's been, not just here in the United States, around the world, where I know many people may be listening from different parts of the world. This is something we have to address. So what are some science-based strategies? There's a lot we could talk about. You mentioned one before I'm going to highlight, which is this aspect of gratitude. There's actually such a depth of science about cultivating this attitude of gratitude, so to speak. It's kind of a fun way to remember it, but there's power in it. And so what that can look like, to be honest, some of the science-based strategies are things like, I'm going to give you a great practice. My students love this, and hopefully listeners, you'll love this too, you can choose when you do it in the day. It's up to you. But every day, many people find it helpful, maybe right before bed, before your head hits the pillow, is to literally pen to paper. I like that practice, a little old school, but pen to paper, writing down 3 good things that happened to you that day. And there's science to say that not only just feels good, maybe reflecting on that, but it actually has positive impact on your health, physically, psychologically. And it's as simple as that, a couple of minutes to reflect on 3 good things. So that's a well-established practice. Dr. Martin Seligman, I know, Dr. Mantell, you will know all about this, but to say that's a powerful practice. Also expressing gratitude to others. There's another great practice called a gratitude letter. Maybe someone in your life that you say, you know what, I appreciate them and love them so much, but I don't know if I've ever fully articulated that real love I have for them and my genuine gratitude that they're in my life, that they care about me. And so taking time to write that handwritten letter, and then part of the practice could be hand delivering it. Wow, what an exchange to look someone in the eye and hand them this powerful letter. Or if it's someone, maybe at a distance, putting it in the mail, or you can do it via email too with technology. But those are a couple examples around this aspect of gratitude and the impact it can have on our health holistically that I think are very exciting.
And when you think about this, if you have, let's say, a surgical procedure or an ailment of some kind, do you think your physician would prefer you to be optimistic about the healing and hopeful that it's going to work out, or convinced, oh, this is never going to help, this procedure is going to not help me, I'm not going to get over this? What do you think about optimism and hope?
They're vital. They're vital to health and well-being. And I know there's so much more on this topic, and I know our time is quickly concluding, but I will share this. Hope is essential to health. If nothing else to take from this conversation, I would say hope is essential to health. I think has a tremendous impact. Even the way we think about stress, just to say this, a stress is enhancing mindset. The work of Dr. Aaliyah Crum says we can actually change our health positively if we think even when we encounter challenging times, we can rise to the occasion. In fact, we can rise above it, that optimistic perspective. Whereas if we think stress is debilitating, it's going to destroy our health, it's going to be terrible. If we're in that cycle, it actually can be quite detrimental to our health. So you're onto something big here, Dr. Mantell, and how delightful. This is only part 1 of a multi-part series to come talking about these important topics.
Amen.
Well, both of you all are on to something big right here, and we're out of time. But again, Jessica, we're going to extend you another invitation if your schedule allow you to do this. This was absolutely fantastic. So I want to thank you for coming on the show today. We'll certainly see you again. I'd like to thank my guest co-host, Dr. Michael Mantell, for help putting all this together. And, this is just part 1. We every Wednesday. But most importantly, I'd like to thank Michelle, my wife, for putting together a great program. And I want to thank our viewers and our listeners around the world for tuning in Monday through Friday, 12 p.m. Pacific Standard Time. Always remember to dream big, think big, and be big at everything that you do. We'll see you tomorrow, same time, same place. It's your life.